If we look at, the key issues that Kenyans want addressed as a matter of urgency, what we see that there is not much change between April and June in terms of the issues that matter to Kenyans. Indeed, the first issue that matters to Kenyans is still the coronavirus and the COVID-19 pandemic. So 47% of Kenyans want government to still address that issue. In April, we had 55% who were concerned about COVID-19 as an issue that government should handle as a matter of priority. Food security is still very high at 45% and is the second, most burning issue of priority. And the third issue that Kenyans want government to deal with is unemployment, as was mentioned by 35%. Indeed, there is a change in terms of the ranking of unemployment as a priority issue. In April, it was not, among the top three. The third issue was access to healthcare, but it has now come up from 25% in April to 35% now. And that is understandable because we hear every day about the loss of jobs and the loss of incomes and livelihoods of many Kenyans. So those are the top three issues that Kenyans would like government to deal with: COVID, food and poverty, food security and poverty, unemployment, and over and above that, they would like also to see poor infrastructure dealt with. Occasioned by the floods and the heavy rains, Kenyans have been, subjected to very, very poor road networks and very unstable and reliable electricity. And they would like this as the fourth item and issue that government to deal with. Kindly make sure that our roads are safe for use, our bridges are fixed after the flooding, and that electricity is more reliable than it has been in the past 2 months. Access to healthcare still continues to be an issue for Kenyans, and so we see that 18% still feel that access to healthcare is something that government should look into, both with regards to access to healthcare should anyone get the coronavirus, but also with regards to access to healthcare now that health institutions seem to be dealing more with the coronavirus than anything else. Many respondents that we spoke to are skeptical and fearful about visiting health institutions, just in case when they visit those institutions other things happen to them and they may even be quarantined. The next issue of concern, which then becomes the sixth issue of concern, is access to clean water. And we saw that respondents were telling us that there are cities, including and especially Nairobi, where water has not run in the taps for more than a month, and people are spending a lot of money accessing water. The flip side and irony is that water is one of those critical elements that is required for the cleanliness that is a preventive measure, that is a prescribed measure to protect against COVID-19. The high cost of living is then, another in the top 10 of issues. And of course, there's a quality of education, especially in the public health sector. And the questions that behoove are, how can our children learn remotely in a manner that is effective enough for them to get proper learning? So the top 10 issues, just to sum it up, that Kenyans want President Uhuru and his government to deal with are: 1, the coronavirus, that's at 47%. 2 is food security and poverty at 45%. 3 is unemployment at 35%. 4 is the poor infrastructure, which is roads and electricity at 19%. 5 is access to healthcare. 6 is access to clean water. 7 is access to high cost of living. 8 is the quality of education. And then 9 is access to affordable and reliable transport facilities, and 10 is disaster management. The dealing with floods and the dealing with things like the locust invasion. Those two have not escaped Kenyans. But Kenyans also mentioned other issues that they would like the government to deal with. Indeed, they mentioned the high cost of doing business. They mentioned corruption. They mentioned the land squatter issue. But interestingly, Kenyans also are not lost to the fact that this new, crisis, the pandemic, the new normal, has occasioned higher alcohol and substance abuse amongst, across Kenyans of all walks of life. And so we find that 2 out of every 10 Kenyans is quite concerned that government should do something about the alcohol and substance abuse problem that perhaps is now even more prevalent than it was before. They also want the government to deal with ethnicity and tribalism and constitutional reform.